According to Miranda Ferreira, author of the Human Diseases and Conditions book, the rate of depression for teenagers may be as high as 1 in 12. Hi, my name is Hayley Akel. Mental health is a big part in daily life. Many of my family members and relatives have had mental illnesses. Whether you have been affected or know someone who has been, mental health focuses on our emotional, psychological, and social well-being. It affects how we think, feel, and act, and how we handle stress, which affects everyone. Today, I will discuss depression and stigma in order to educate the audience on mental health perceptions in society. Let's preview my main points. First, I will talk about depression's definition and description. My second point, I will talk about causes and symptoms of depression, and in my third point, I will talk about stigma. Now let's start with my first point. My first point, I'll describe depression. According to Manny Gonzalez and Lisa Colarossi, authors of the chapter Depression in the Handbook of Social Work Practice with Vulnerable and Resilient Populations, everybody feels sad. However, we use the term depression to connote a mood disorder occurring if specified mental health criteria are met. And we do this usually through a questionnaire, which is done in psychiatric diagnosis. So this is one that I found online, and essentially this is given to the patient. They are asked if they feel worthless, or if they feel helpless or sad or a failure or depressed, all of these emotions in the past 7 days, and they ask basically if they felt this never, if they felt this often, basically how many times they felt this way. And then at the end they are given a score, and this is given to their physician, and then they can make a realistic diagnosis about their symptoms. They can also be given a series of other tests, whether these are questionnaires or just how they feel. It all kind of comes together to make the diagnosis stronger. And this is from the American Psychiatric Association, which was developed in the year 2000. Overall, depression is not really an emotion. It's a mood disorder, and it requires diagnosis. And depending on your symptoms and depending on how often you feel them, it can be really severe to your life. It can really upset it. Next, I will talk about the causes and symptoms. My second point involves causes and symptoms. The Gale Encyclopedia of Alternative Medicine, edited by Teresa Odell, author and psychologist, supports that these are the common causes and symptoms of depression. Having an imbalance of neurotransmitters in your brain, which affects the amount of serotonin levels in your brain, which is the hormone for depression, is one of the psychological causes, but now I'll kind of get into the more environmental and genetic ones. A person's upbringing can significantly affect if they have depression. If you were abused or if you just had a poor environment, then you are at higher risk. Genetics, essentially if you have a family member who has died or is still living with a mental illness, then you are at higher risk for having one. And then significant life changes. If you have a divorce, if you lose your job, these can affect if you have depression, but these really affect adults, essentially. So death of a loved one, which can affect anyone at any age, is a better look at how causes can significantly affect you. Then symptoms. If you have a change in weight, if you are overeating, or if you have a loss of appetite, sleep changes, essentially if you have insomnia or you have excessive sleep or you have trouble staying asleep or going to bed, these can affect you. Loss of energy, feelings of worthlessness, hopelessness, or guilt, diminished concentration, recurrent thoughts of death or suicide can strongly impact if you have depression. A 2003 study reported that 2/3 of patients with major depression stated they also suffered from chronic pain. So even though I didn't mention pain, pain is also another symptom of depression. It can be difficult to 100% accurately diagnose a person or pinpoint the exact problem. However, these are the causes and symptoms to look out for. Next, I will talk about stigma. My third point is stigma. There are many stigmas that have negatively affected people, whether they're depressed or they're just in society. The role of the media is a big stigma that exists in society. So in movies and TV shows, sometimes mental health patients can be portrayed as hostile or dangerous, and this obviously makes people think that they're crazy, which is unrealistic and also very wrong. According to Gale Encyclopedia of Mental Health, stigmatized groups have less access to educational opportunities, well-paying jobs, and healthcare. Stigma also makes people hide their identities and their mental illness because they think that people won't accept them or understand them, or they'll just think that they're unfit for society, and this can obviously cause a lot of strain to their lives because they're constantly hiding who they are and how they feel. An editorial published in the Journal of the American Medical Association in 2001 tells a story of two sets of parents coping with their children's mental illness. The stigma of the patient extends to the family members because they are seen as the problem. This shows the power and problem with stigma. Stigma is powerful. It can hurt depressed people and influence an unrealistic view on mental health in society. Now that I've talked about my last point, let's conclude. Today, I informed my audience about depression and stigma that exists in society. Let's review. My first point, I gave a description about depression. My second point, I talked about the causes and symptoms. And my third point, I talked about stigma. Depression affects many people, especially teenagers. It's important to look out for the things I've discussed in this presentation to have a better understanding of mental health. Now that I've discussed depression, I hope more people are informed about the illness. Thank you. My name is Hayley Akel.